Hello, and welcome to my introduction of the Leo board. Hello everyone, my name is Dr. Robert Walker, and I'm a resident in Philadelphia, Pennsylvania, and also the creator and founder of the Leo board. I wanted to make this video to show you the great capabilities that my surgical training boards have in helping the future surgeon reach their goals and highest potential. Starting from the basic level as a medical student or a veterinary student or a physician assistant student, all the way up to resident to attending who wants to refresh their skills. The Leo board can get you there. I created the board initially as a simple tying board to help my medical students learn how to do their surgical ties to do well on their rotations. On it, it contains a normal tying arch, a deep space arch, and then also tying against resistance. That board is still available, and the nice thing about these boards is that they're very heavy and they will not move around when you're practicing. That board slowly morphed into what now I call the Surgery Gym, because I wanted something that would allow the trainee and their skills to allow the board to progress with the trainee as their skills grew, and to focus on particular aspects of the arsenal of the masterful surgeon. So this is the Surgery Gym. It is a very heavy weighted board. It's about 6 by 10 inches, so it's very compact, but it will not move when you're practicing. On the board, there's 4 main areas of practice. There's a simple tying arch, a deep space arch, tying against resistance. And the thing that sets this board apart from all other surgical training boards is a removable attachment section that has a magnetic strip that you can use specific attachments to allow you to develop your skills as a budding surgeon. So let me demonstrate those now. The first one is a simple suturing laceration. This allows you to have a skin-like or tissue-like silicone that's self-healing that you can use multiple times, and it also holds your needle in place. It's like a normal tissue, so you can practice releasing it on the needle driver and then picking the needle back up. It has a magnetic bottom that attaches to the board and is very strong attachment, so it will not come out and move around on you. So that is the simple suturing, but you can use it for practicing your running. You can different types of interrupted sutures, vertical mattress, horizontal mattress, the list goes on. And it's very important as you learn with different types of suture and how much tension you can put on the suture to bring the tissue together. And these will get you there. Next, I have a irregular laceration attachment. So it has a curvilinear suture and almost like a star-like one that allows you to practice either doing it's deep enough where you could do a 2-level closure if you wanted, and then also just practicing bringing something that's not a straight line together nicely. Also has a magnetic attachment to attach to the board. Next, I have what I think is a very unique training attachment, and this is a clear silicone. And what this allows you to do is really focus in on gaining control of your needle, okay? So when you are closing tissue, I make the mistake as well, as everyone does, is keeping the 2 opposing sides of the tissue nicely approximated. Many times you'll find where the incision and you're suturing and you're moving along so nicely, and then all of a sudden the ends, one is higher than the other or vice versa, and you gotta practice learning how to go either shallower on one side and deeper on the other or vice versa to bring those tissues back, because you can't start over, you can only move forward. So the clear suturing attachment is very nice because you can see the needle as it goes into the tissue and then come out, and then learn how to really precisely and accurately control that needle tip. Also attaches to the board. Next, I have an attachment for learning how to suture in deep, tight spaces that I developed after watching several spine cases. So this also has the long suturing laceration, but it is enclosed within about a 1.5-inch high box. And this really lets you focus on learning how to utilize a needle driver and a forceps and not being able to be so close to the tissue, and also learning how to even just use your hands to tie in a very tight spot. Very useful for patients or learning how to do cases like spine cases. Also attaches directly to the board and then has these cutouts to help you remove the suture easily so you can move on to the next time you practice. And then lastly, I have a membrane type of suturing practice attachment, which I developed after doing brain cases where you have to suture dura, and learning how to use very fine filament suture, such as a 4-0 neuralon, or even all the way up to like a 6-0. You learn how to use the tools and techniques. I've used this under the microscope as well, the surgical scope, to learn how to do it, and then also with my loops on, to really learn how to control and be proficient at tying and suturing on a very thin surface. And how this works, it has a magnetic base, so it attaches directly to the board, and then also it has a empty cylinder with a ring that comes on top. And all you need to do is get a surgical glove, cut it into a square, and then, or even a tegaderm, and then put that on top. You put the glove that you cut into the square on top, you put the ring on, and it gives you a nice membrane-like or thin tissue-like feeling, and it will hold nicely. You use a scalpel and you make an incision to give you a laceration, and then you just practice suturing. And it's very nice for learning how to do very thin. And also when you know that you'll be suturing above delicate structures, this is very good for that. All of my boards come with a 2-tone suturing cord or tying cord that lets you learn for your initial practice how to get a very square knot, which can be difficult, especially when you want to practice something over and over again. This lets you do it so you don't have to waste a bunch of suture or annoy your resident after you've sutured the phone cable together or something like that. We've all been there. That then allows you to progress to learning how to use a regular suture, whether it be a nylon, a monocryl, a proline, whatever. They all have different fills in the hand. They all, even within the different types of suture, they also have just learning how to handle them all with the thicknesses of the different sutures. So this is the Leo board. I hope you will consider it as a training tool as you progress throughout your career. Also tune in the very near future, I will be having an entire course on all things tying and suturing. In addition to that, also the theory behind why you have the differences of suture versus a braided or a nylon or a proline, and how they're formed, an SH needle and why it's called that, and a cutting needle and why it's called that, and all the different theories about why you want to use a different suture when. So that is going to come soon, and you can get that all on theleoboard.com. Thank you so much, and I appreciate you taking the time.